and the appropriate rehabilitation. The rehabilitation post-stroke can also be moved closer to home. You could do this once they've stabilised. First few days, extremely important. That happens in the unit. There's no reason why the post-stroke physiotherapy can take place in Bracknell, can take place in Windsor, can take place in Slough. At the moment, it isn't like that. The top one is incredibly important. Okay? The nearest trauma centre to here is John Radcliffe. Now, they recently declared there were going to be 4 trauma centres in the south central region. Southampton, Brighton, Oxford, and the 4th one was in Brighton, Southampton, Oxford. I think it was, where was it? Was it Swindon? Bristol.
At Bristol, yeah.
And I think to myself, well, hang on a minute. So you've got Heathrow Airport, you've got Crossrail, you've got the M4 motorway, which can be extremely busy. You have the Great Western Railway. You have population density. You also have the M40 as well and the associated bypasses such as the A329. And you don't have a primary trauma centre. Nearest one is John Radcliffe. If you consolidated your services, you could. The reason you could is that if you were serving 650,000 people, you would have the necessary orthopaedic and neurosurgical backup. You could do it. You could have the facilities. It would be easier to staff the hospital, to implement the necessary rotas in order to be classified as a primary trauma centre. You cannot in a small district general hospital. It's not possible. And so I thought that was quite a nice byproduct of consolidation, was that we would actually end up with a trauma centre that I think is fit for the region that it serves, and with all the necessary, with all the transport infrastructure that flows through here, not least of which, what happens if a plane lands on the M4? It probably won't happen, but I'm sure there are plans in place, but it will involve a lot of people being relocated to other hospitals further afield. And I just think it would be ideal if it was not too far afield. Now, in terms of enhancing, I've already referred to this. I mean, essentially, all of the stuff, the majority of the care that the National Health Service provides, both in terms of actually the number of consultations, but also in terms of cost, the majority of it doesn't happen in hospitals. All right? It happens in primary care, it happens in the community. Increasingly, and this is going to be driven very much by the commissioning groups, the GPs don't want their patients in hospitals. All right? It's the last place that they want their patients for very raft of reasons. All right? They want them out of hospitals. Okay? Most hospital stays now are a matter of days, if not less than a day. It used to be after a heart attack, for example, you did 2 weeks. How many people stay in now for 2 weeks after a heart attack? It doesn't happen. So increasingly, people are coming out of hospitals. What's that? What does that mean? It means that it's good for the patient, because hospitals generally are pretty dodgy places to be. If you're a patient, you don't want to be there. And secondly, it's cheaper, it's more cost effective, and with a finite budget, that actually is really important. But it does mean that there's going to be less activity going through hospitals, okay, which will lead to hospital closure and hospital consolidation, which is now what's happening with Heatherwood, Wrexham and Frimley, and it will happen. Wickham is now going that way, and it's happening across the country. This is not unique to this region, it's happening everywhere. And what will happen is that this type of thing, and I'm sure either yourselves or your family have had one or other of these, have interacted in this way, all of this, I would envisage, will take place in Bracebridge and Bracknell. Okay? None of this will happen in the big hospital. And you could add a list, there are other things you could add to this. You could do antenatal clinics, you could do all the other things. It all take place in Bracknell. You don't have to travel to the hospital, you just go to Bracknell. But if you're sick, if you're properly sick, you need an operation, a really complicated, difficult operation. You don't want to have that at Heatherwood. You really don't. You want to go to a proper hospital that's properly staffed with an intensive care unit. Right? That's what you should want to have. You cannot have it at Heatherwood because you just can't. It's just not a location that's going to support a hospital that is going to be properly equipped and skilled enough to provide the level of care that you would seek to have as a patient. I find it remarkable that one of the theatres at Heatherwood is from the Falklands War. I mean, the fact they just picked it up from the Falklands and came back and dumped it at home. That's one of the surgical theatres. You go outside to go to theatre. This is, you know, I'm sorry, if you want your MP to go into bat to defend that, I'm not your man, all right? I am not going to defend that. It's not defensible. What I will defend is the maintenance of these types of services within the community, because I know the majority of people's interaction with the National Health Service is for this sort of thing. It isn't for the serious stuff. This is, so, in conclusion, you know, total cost of project less than 0.1% of central government annual spend. I mean, you know, this is why I'm telling you it's modest figures. If you think about it, and it's to serve over 500,000 people likely for the next 40 years in an incredibly affluent area. I mean, it's not just an affluent area of Britain, it's an affluent area of Europe. All right? We really should have a decent hospital that does everything. And I think we should aspire to having that hospital. And we need a hospital that is sustainable, that is affordable, that is going to be there and be able to withstand the demographic change that the whole country is about to embark upon, which is incredibly challenging. An ageing society is going to have profound impacts on all of our lives. We're not going to just be responsible for vulnerable young people, babies. We're also going to be all responsible for vulnerable old people. And how are we going to deal with that? How are we going to cater for the doubling of dementia in the next 10 years? Anybody here got dementia in their family? If you have, think about it. Think how difficult that is for everybody. Well, that the incidence of dementia is doubling. Diabetes is going up to 25%, 25% of the NHS budget by 2025. One condition. Depression continues to increase. A drug that's prescribed quite regularly, sadly, by GPs. All of these things contribute to one thing, to one conclusion. The current status quo is not sustainable and is not in our best interest as a community. So in the light of that and in response to that, your Member of Parliament is trying to put forward a credible plan. It has some flaws, there are some inaccuracies in that plan. It was put together pretty much in my spare time with Eva. It was very difficult, very challenging to put together because we met with quite a bit of resistance from different quarters. But we thought, you know, we'll stick it out there and we'll provoke some debate. Now, in the final remarks I will make are about the situation currently. Heatherwood and Wexham has an £80 million debt. Okay? It's not a viable institution. That's why it's in discussions Phillip Lee. I don't know what that's going to, how that's going to lead to how they're going to structure care in the future. Some of the things they've put forward with regards to Heatherwood, I have not supported. And I have made that clear in a letter to those concerned. Again, I also have the problem that I found out about it like you would find out about it. They didn't even have the decency to write to me to explain exactly what they were proposing. I'm going to be dealing with that going forward. The reason I'm not fully supportive of what they've advocated is because essentially they're selling off part of Heatherwood, and that money is being used to fund essentially services at Wexham. And I struggle with that because it's yet again further evidence of what the public around here don't like, which is the death by 1,000 cuts of healthcare services serving this community. And trust me, it's much worse here actually. You're experiencing it now, but it's been going on around here for some time. Something I've been aware of because I've worked at Heatherwood. Okay, so I've been aware of it. And so I'm not in favour of the approach that has currently been taken. Some of it I have supported, minor injury units to Bransbridge and these sort of things. But what worries me is nobody's actually stepping back and going, right, what actually is the solution? What's the strategic decision for a region? And the reason that hasn't happened is there isn't anybody who's responsible for that happening. Something which I've made quite clear in Westminster, that there isn't actually somebody you can look down on this and go, right, well, the solution is that, whatever that is. So you have this sort of make, do and mend, you know, and things evolve in a certain way because no one steps back and says, let's just stop spending money and work out what should we do for the future. And I am a bit frustrated by that, so I will continue to sort of push as much as I can. I'm hopeful that another hospital trust will enter into this merger with these two. And I think, I suppose, in Bracknell's best interest, that would be Royal Parks, because it would then pull sort of epicentre of the three of them working together closer to where we are. I don't have any control over that, other than to say that I think the financial realities are going to point in that direction at some point. And then hopefully at that point, somebody in an appropriate position will grasp the nettle and say, right, the best solution for the communities we serve is to consolidate our acute services on one site and retain chronic care services in the way that I've described. All I've done with this report is implement a hub and spoke model of care that other people invented, that other people have thought about. It has the support of the Royal College of Surgeons, the Royal College of Physicians, the Royal College of Paediatricians, the Royal College of Obstetricians and Gynecologists, the King's Fund, which is a centre-left think tank about health matters in London. Anybody who knows anything about the way in which healthcare needs to be structured supports the idea of a specialist hub and then spokes out to local community services. I'm open to suggestions for a different location, but I must stress to you that it has to be on a transport hub in order that it can serve the necessary 500, 600, 700,000 people. There's no avoiding that, and I don't think there's any better location than the M4 motorway.
I think you couldn't choose a worse location.
Well,
I work in Reading at the moment, and every morning when I join the M4 and turn left,
yep.
from Reading all the way through past Maidenhead
Yep.
is gridlocked.
Yeah.
I've actually worked in the Globe Business Park on the M404.
And it gets gridlocked, yeah.
And driving home from there to Bracknell's taking me over an hour every night. Your map where you say about the 20-minute drive zone.
Yeah, that's blue light time.
Yeah. But unfortunately, people that are driving there to visit and whatever.
Yeah, but I'm not, with the greatest possible respect, I'm not interested in people's visiting travelling time. I'm interested in
people have
blue
still
light
got to
time.
get there.
No, I'm interested in the blue light time. And if you're on a
But you haven't
motorway,
made that clear in there.
as I've said, this is not a perfect.
I know, but if this is forward as a proposal and you want to win people over, then it might be helpful if you did explain
Yeah,
that this is what you would expect
right.
the emergency services to do. Because people are picking this up and saying, what, this in 20 minutes?
Okay, so what happens now?
You're putting, you know,
Yeah, but what happens now? Where'd you go now?
I don't know.
I tell you where you go now, sir. You'll say, the hospital that technically covers this area is Wexham Park Hospital. Okay? You currently go down the M4.
Yeah, I'd rather cut my leg off and go to Wexham Park.
So what's your solution? So you'd rather go further, or?
I'll go to
No,
Frimley.
we go to Frimley.
Okay, well that's a choice. I'm not advocating. But the point I'm trying to make to you is that I've had this at other meetings. It's like, so what are you saying? So what is the location where there isn't a traffic jam problem in the Thames Valley?
There isn't.
Exactly. So what's your locations? If you're going to have a location, I would suggest that having a hard shoulder is perhaps a bit better than it being on a road outside of Slough, which is a single-lane carriageway, or at the bottom of the Marlow here in Wickham, at a roundabouts, which is also gridlocked most of the time of the day, or or at Frimley Park, which is hardly the most appropriately located hospital. All of those hospital sites, the Royal Berks, don't even get me started getting to the Royal Berks, all of these sites are inappropriate. And what you're suggesting to me is that mine is more inappropriate than those. A site that is actually on a motorway that has a hard shoulder that an ambulance can go driving along, irrespective of whether there's a traffic jam or not. And you say about visitors, I'm sorry, sir, acute hospitals are not designed for visitors. They're designed for care. They're designed for providing the appropriate care.
I thought the idea was to care for the whole family.
No, I tell you what, if I'm having a heart attack, I want to go to a hospital where there's appropriate facilities, and more importantly, a highly skilled cardiologist if I need an interventional cardiology procedure within hours of arrival, within minutes of arrival. But you don't get that
Can I
Yeah, I mean, the point is that you're right. Of course, it's a pain in the arse that all the roads around here get gridlocked. But that's actually to do with overdevelopment without necessary infrastructure to support it, which is a whole different debate. But if you're telling me there's a better location than being on a motorway, I don't understand, because the motorway, at least it has a hard shoulder. At least it has a lane that is clear for a blue light ambulance to travel along with somebody whose time to needle, whose time to surgery is hugely important. I mean, it really makes all the difference to whether someone survives something or not. And I don't see how you go anywhere other than a motorway. I mean, I think it's that's all we've got.
That's what you're saying. I think this is the most important thing. And if I get ill, I want, as quickly as possible, to get the very, very best treatment, because I want to carry on living. Now, I don't want to stay in that hospital too long. And if there's consultations after the event, I want to be able to go locally. I don't have to go there. I'm not too worried about my family coming to visit me in a centralised system, because I'm not going to be there that long. And wherever it is, you're going to have these traffic problems. But I thought, on one of the previous slides, you'd said 500 million, then you added another 250 in.
Well,
for whatever.
To upgrade all the other sites.
The thing is, if it were to go ahead, you'd have to reflect in the planning of it the transportation difficulties. But what I really want to say is, first of all, I think it's absolutely appalling that a single MP has to actually push this forward, because I don't know if Dr. Lee's right or wrong, but it should be, the NHS ought to be looking in the round at what is going to be best for us in the future. And when I look in the consultation in Berkshire about the future, there's not one reference to this concept. So I got in touch with them and I said, look, we're making various proposals, but there's an MP going around who's talking about this hub and spoke arrangement. Why haven't you included that? And I didn't get a satisfactory answer. And I'm sorry, but if the PCTs, as was, we're going to go to the public and say, look, we've got these various options, to not even mention a major possibility like this is out of order. Now, I live in Buckinghamshire, South Wales. I got in touch with my PCT, as was, and my hospital trust. And you know what the hospital trust said? They said they're absolutely encouraged, and I think it's a marvellous idea to have this sort of super hospital concept, as long as it's in Wales. Now, I'm sorry, but what's happening here is blind patients, blind public, vested interests are actually excluding debate within the Berkshire proposals, but only going to be looked at in Buckinghamshire if the hospital ends up in Buckinghamshire. And that is not looking after our interests.
Yeah, I mean, the other thing I didn't mention was when I barked upon this, it turned out that a rather expensive process was went through in 1989 in East Berkshire, where they commissioned Deloitte to produce a proposal of a new hospital for the area, and they concluded Junction 89. And at the time, the then Health Authority ruled it out because of cost and decided to persist with maintenance of the sites we had, which is what we're doing again. And I just sort of look at it and just think, at what point are we going to wake up and smell the coffee that we have a population that has increased in size and has aged and has more chronic disease in it, that we need to change the way in which we structure our services? And apparently, judging by the Bucks process of listening to the, shaping the future, and now the Berkshire shaping the future, which I read today's cost £800,000 to run this consultation, in order to what? To conclude what? That the people of Bracknell want a hospital at Heatherwood. Well, I could have told you that, because I knock on doors, everyone wants it to stay at Heatherwood for understandable reasons. Their kiddies were born there, they were born there, whatever it is. And the people of Slough want it to stay in Slough, and the people of Windsor want the King Edward VII to stay where it is. Nobody wants any change. God forbid that we would even suggest or indicate that maybe change is required. When in fact, actually, what I'm advocating here improves all services for all people. What's not to like? What's not to like? I don't, you know, we can argue the toss over whether it's junction 10 or junction 8, 9. I mean, I could be all night arguing about, oh, maybe we should put it between the two. Maybe we should have a special location, just north and south. Wherever it is, the concept of consolidating services and then putting chronic care services out into the community is in everybody's best interests. You will get better care, and above all, you will get better clinical outcomes.
So the question I really want
So the point is that you're right. I bang my head against the wall. It's like, well, who is going to actually grasp this?
We've now got, we used to have PCTs, they've doubled up, we've now got the CC chips.
Yes.
And I'm sure they're going to be a very good thing. First signs are very good. But there wasn't, you said, there wasn't someone that looks, there used to be a strategic health authority. That
But there's no evidence of any strategy, so I don't actually know what the strategic health authority is.
How do we, just as Joe Public, how do we impress upon the decision makers that there is a concept here that needs to be looked at properly?
Well, I mean, first of all, I suppose I should say, now, where am I now? This is the last public meeting I'm going to have. Okay, I've done my bit. I've been around the region. I've had a bit of cover in local newspapers throughout the region. If people don't know about it, it's because they've not engaged in the process. All right? From now on, to a certain extent, it's over to the general public to push and to do what you did and to ring up and say, well, hang on a minute, how come we're not thinking about this? My responsibility, which essentially was always my responsibility, I'm elected to be a member of Parliament to represent your best interests at Westminster. That's my primary role. Okay, I'm not a local councillor. I'm supposed to be